The hepatitis C treatments that we've been developing have changed people's lives in that the old treatments used to be about a year long. You felt terrible for a year. Imagine having influenza for an entire year, and then there's a 50 to 60% chance you get cured. We're now talking about 8 to 12 weeks. You don't feel like you've got the flu, and 90+% of the patients are cured.
The whole phenomenon of health data analytics is very new. We are looking into data from various perspectives. We collect a lot of data, whether it is imaging data, whether it is lab data, whether it is patient data, films, we have videos and so forth. Our job as a company is to find patterns within these records. And by finding patterns, it can help patients to pre-identify or predict some of the ailments they may be getting in a few years.
SMART Network stands for Sensory Motor Adaptive Rehabilitation Technology. It is a center that brings many disciplines together, including biology, neuroscience, computing science, engineering, and clinicians all together with one primary goal, and that is to improve the life experiences and abilities of people with neurological conditions and disease such as stroke, spinal cord injury, Parkinson's disease, multiple sclerosis.
Particularly here in Edmonton, the sort of health innovations that we've been working on at Gilead, Alberta, primarily over the last few years have been on hepatitis C, curative treatments, and new improved HIV treatments. So we've been working on shorter treatments for hepatitis C, where the side effects are lower, the duration of treatment is lower, and the efficacy is much higher. HIV, again, lower dose, fewer side effects, more efficacious.
The ability to stand and walk again is really a dream for everyone who is in a wheelchair. The ability to live a healthy life after being confined to a wheelchair is very important. So how can we prevent pressure ulcers? How can we prevent deep vein thrombosis? How can we prevent their shoulders from being injured because of using wheelchairs? It's a big thing that we work on, and we have innovations in all these areas. If someone happened to lose a limb because of injury or disease, now an artificial limb needs to become something that would work with the body. So how do you make an artificial limb feel like it's part of the body? These innovations that we are having over here are making people live better lives.
So Microsoft noticed that us as a small company from Edmonton were doing some groundbreaking research and development into cloud-based electronic medical records technology as well as health data analytics technology. And they approached us. They approached us from their side. They were very sure that this was a good match for them. We had to see from our side that it was a good match for us too. And naturally, it was a delight when we saw what they were doing. They were doing in their future technologies that they were working on were very much synchronized and aligned with what we were doing. And so we partnered with Microsoft based on common themes and common vision.
Edmonton has been a great base. Again, historically, they've been not only that concept of interdisciplinary research that has a very strong history here at the University of Alberta, but Edmonton and the province of Alberta had a very strong way of supporting research, and primarily interdisciplinary research, starting from the Alberta Heritage Foundation for Medical Research and all the way now to Alberta Innovates.
We have very high-end hospitals in this area. We have some very talented scientists in this area as well. We have great academic institutions who can provide the talent that we require.
It shows that Edmonton can compete successfully in other areas other than oil and gas or forestry or farming. We're able to attract people from all over the country to Edmonton to come and work here. So I think that's a big difference.